Few moments from now, President Trump will announce new deals meant to lower the prices of drugs and other pharmaceuticals. Let's bring in Dr. Mark Siegel, Fox News senior medical analyst and author of The Miracles Among Us. Doc, good to see you this Friday afternoon. So this is under President Trump's most favored nation negotiations with pharmaceutical companies. He's already inked 5 deals previously with companies like Pfizer, Eli Lilly, AstraZeneca, and Novo Nordisk. What is, for folks at home who don't know, most favored nation, and how does it work?
Well, most favored nation is based on the idea that we're being robbed, John, that if you take the other nations in the world that have similar economic stature as us, we pay 3 times as more for medications than they do, 3 times more on average, and in many cases it's much more than that. Well, drug manufacturers say, well, we need the money to justify research and development, but Trump is fighting back and saying it's a use of market. You know, let's use the free market to negotiate prices. And he's been making a lot of progress. And I think I have a story I always tell about how Germany was negotiating with Pfizer years ago over Lipitor. And Pfizer gave one price, Germany gave another price. Germany got its price because Pfizer couldn't afford to walk away from a whole country. And that's the concept that he's using here. Coming to the table today, you're going to have Merck, you're going to have Gilead, you're going to have Novartis, which is a huge drug manufacturer. Merck, makes Gardasil. Merck makes a lot of drugs for immunotherapy. Keytruda, which is a groundbreaking drug Merck makes. So this is a big day.
Right. Okay, so you've got these other drug companies. It's at least 5, which makes it 10 now. The promise of lowering drug prices is a big one, obviously, that a lot of people who are on Medicare or Medicaid really care about. What does it mean for everybody else who's on private insurance or maybe paying directly?
Well, I'm really looking at that closely, and you always ask the best questions. Medicaid is what they're targeting now, and Medicaid is known for having state formularies that set prices anyway. If they get Medicare on board with this, then I'm going to tell you something else, which is private insurers always follow suit. That's the jargon in the medical profession. Medicare is not going to pay less, and then the privates pay more. The privates will lower their prices to compensate, to be in line with Medicare. That means prices lower across the board. And of course, you've heard the expression Trump RX. He literally intends to create an exact place where people can go with their private insurance to pay less.
Well, we always hear from the drug companies about why the price of pharmaceuticals in the United States is so high. It's because this is where the companies are headquartered for the most part. This is where they do all of the research. Research is expensive. Somebody's got to pay for that, and it always comes on the back of American consumers. So if you go with most favored nation in these negotiations, is there any potential downside in terms of effects to research, maybe availability of some drugs to people here in this country?
Well, I'm worried about that, and I'm also worried about a corollary to that, which is, will drug manufacturers drop out of the game if they feel they're not making enough profit? You know, some of the drugs that I mentioned already, immunotherapies, chemotherapies, Eliquis is one that's made by Gilead, which is a huge drug for blood thinning. Not Gilead, Bristol-Myers Squibb, rather. Yeah. Bristol-Myers Squibb makes Eliquis. That's a huge drug. We don't really have another one. We got 3 or 4 other blood thinners that are really good, but that's our frontline drug. So if they decide they can't afford to make it, we have a problem. On the other hand, what the president is saying here is we shouldn't be shouldering the prices for the rest of the world. And he's absolutely right about that, I think.
Yeah, I mean, when you consider, just a real quick story, when I had malaria back in August, the drug that I received in this country cost $25,000 a dose. I got 4 doses of it. That's $100,000. That same drug in places like the Congo is about $4 a dose. So, I mean, why are we paying so much more, Doc?
John, you're making great points there because, in a sense, they're holding us hostage. Your life was saved by that drug. I heard you. Your life was saved. You would have paid anything that you could. But, of course, we shouldn't be paying so much more than they're paying in Congo. I mean, we want everybody's life to be saved in Congo, but we want everybody's life to be saved here. And we can't afford drugs that are the top of the top, the best of the best, to be made less available because drug manufacturers are worried about their profit margins. So we got to share costs. So most favored nation shouldn't mean that we pay less than everybody else, but we shouldn't be paying more either.
Indeed. All right, Doc, we look forward to what the president has to say coming up in just a few minutes. Until then, thank you for joining us. Appreciate it.
Hey everyone, I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.